Hello everybody, it's Dr. Omanovic from German Heart Center here in Dubai. Today I am going to talk about heart attack. What is a heart attack? The arteries that supply blood to heart are called the coronary arteries. Blood flows through the coronary arteries to supply your heart muscle with oxygen and nutrients. A heart attack is what happens when the blood flow that brings oxygen through coronary arteries to the heart gets blocked or partly blocked. This happens because coronary arteries can become narrowed from a buildup of fat, cholesterol and other substances that together are called plaque. This slow process is known as atherosclerosis. When plaque within a heart artery breaks, a blood clot forms around the plaque. This blood clot can block the blood flow through the artery to the heart muscle. As a result, heart muscle in that area starts to die. Death of part of your heart muscle is called a heart attack. The medical term for a heart attack is myocardial infarction. What are the symptoms of a heart attack? Don't wait to get help if you experience any of these heart attack warning signs. Some heart attacks are sudden and intense, but most start slowly with mild pain or discomfort. Pay attention to your body and call for help if you experience pain, pressure, or discomfort in the chest. This pain may extend to your upper abdomen, shoulders, arm, neck, and lower jaw. Other common symptoms may be shortness of breath, feeling dizzy or like you are going to pass out, nausea, and sweating. These non-specific symptoms may be more common in women than in men. Sudden onset of fatigue is also an often overlooked symptom. This is also more common in women. If you think you might be having a heart attack, call 911 right away. Do not try to get to the hospital on your own. Is there a test for heart attacks? Yes. If your doctor thinks you are having a heart attack, they might order one or more of these tests. An electrocardiogram (ECG). This test measures the electrical activity in your heart. ECG will be performed as quickly as possible. The ECG gives a picture of the flow of electrical activity that causes the heart to beat. Damaged areas usually show an abnormal pattern. The ECG may be repeated. Blood tests. During a heart attack, the heart releases certain chemicals. If these chemicals are in your blood, it might mean you are having a heart attack. Echocardiogram. An echocardiogram echo is a test that uses high-frequency sound waves, ultrasound, to make pictures of your heart. The test is also called echocardiography or diagnostic cardiac ultrasound. In a heart attack, not all parts of the heart pump normally. Cardiac catheterization, also called cardiac cath, is a procedure to examine how well your heart is working. A thin hollow tube called a catheter is inserted into a large blood vessel in your leg or arm that leads to your heart. How is heart attack treated? If you go to the hospital while you are having a heart attack, the doctors and the nurses will do a few things. They might give you oxygen through a mask or a tube in your nose to get more oxygen into your blood. You may take aspirin or other prescription blood thinner drugs to prevent blood clots. Drugs such as nitroglycerin and morphine will relax your coronary artery and relieve the pain of angina. They will give you pain medicines to ease the chest pain and discomfort of a heart attack. They might also give you a medicine called beta blockers that slow down your heart and reduce its need for oxygen. This medicine can help reduce the damage caused by a heart attack. And we will also try to get blood flowing again through the blocked artery. There are two ways to do this. We can give you medicines through a thin tube that goes into a vein called an IV to break up clots. These have been called clot busters, also known as thrombolytic therapy. We can do a procedure called stenting along with cardiac catheterization. This involves putting a tiny metal tube called a stent into the blocked artery to hold it open. If you cannot get a stent, you may have coronary artery bypass graft, CABG, or if the stent does not work, we may suggest open heart surgery. This is also called coronary artery bypass graft or bypass surgery. What happens after a heart attack? If there are no complications during or after your heart attack, you can usually leave the hospital after about 2 to 5 days. You will need to do some stuff to help lower your risk of heart attack and heart disease. After you have had a heart attack, you will probably need to take more medicines than before. It is very important that you take all your medicines every day as directed. The medicines given to people who have had a heart attack can help prevent other heart attacks, and they reduce the chances of having a stroke or dying. You should take your medications exactly as directed. If you have side effects or questions about your medications, call your doctor before stopping or changing your dose. Stop smoking if you are smoking. Ask your doctor about a plan for giving up smoking and alternatives to tobacco, such as nicotine gum, patches, and prescription medicines. There are also support groups and programs which help people to quit. Improve the way you eat. Try to avoid fried foods and too many foods with sugar. Eat at least 4 to 5 cups of fruits and vegetables every day. Try to eat foods that have fiber in them. Lose weight. If you are overweight, obesity can lead to not only heart disease but also diabetes. Losing extra weight reduces the chance of another heart attack and can make you feel better. Become more active. One of the most important keys to good heart health is to exercise. Some people are afraid to exercise after a heart attack, but that's exactly what you need to do to strengthen your heart and lower your chance of having future heart attacks and heart disease. Walking, gardening, or any activity that gets you to move more can help reduce the risk. I hope you found this very helpful, so if you like this, please hit the like button and sign up for this channel, because I'm going to come up with some more videos that are going to be helpful for you and your everyday life. Stay healthy and take care.